Welcome back, everybody, to IPHA's Talk Series, where we interview various students and professionals within the healthcare field. The purpose of the series is to start a conversation on interprofessionalism, as well as provide insight on the different career paths within healthcare. We hope this helps students make more informed decisions about their future careers. My name is Janna.
And my name is Harneet. Our guest today is a researcher at the OHRI and Bruyere Research Institute with a focus on palliative and end-of-life care. He's also a family physician and a professor. Welcome, Dr. Tanuseputro. We're very grateful to have you here. So to start, we wanted to ask the first question, which is if you could walk us through why you chose to become a family physician.
Yeah, it's interesting. We were just chatting before this interview, but I practice clinically as a family doctor, so I share it with my wife, and she's a family doctor as well. But most of my time, actually, I do research, as you both know. So I do actually clinical work only 1 day a week, and I do palliative home visits as well as part of that 1 day a week. So I visit patients who are dying in our practice in their homes, because often, obviously, they can't visit the office once they're declining, right? Mm-hmm. And I got into medicine. It's interesting. I took a sort of a circular route. So I started off not clearly interested in medicine, but obviously very interested in the healthcare field. I did a bachelor a long time ago in biology and philosophy. Actually, I was more interested in philosophy than biology, and but I knew that was going to be a tough road to make a career with a degree in philosophy. So I chose to pursue the health field. And I started actually with a master's in community health and epidemiology, because I was very interested. I thought I was a pretty analytical guy, interested in what epidemiology, I didn't even know what that word was about, but what epidemiology was about. Epidemiology, as with COVID, is about the distribution of disease and the risk factors and patterns of disease. Including, how to control for infectious diseases like COVID, right? So I was very interested in epidemiology. I did my master's, which is a great master's if people are interested in medicine, but not fully sold on whether or not they want to do the clinical side of medicine. A master's in epidemiology or public health is a great way of exploring, the other aspects of medicine that deals with health, but not necessarily one-on-one clinical practice, right? Mm-hmm. So I started with a master's in EP. I was actually a research coordinator with Doug Manuel, who's a professor here in University of Ottawa, and he was my mentor. And at that time, I was interested in pursuing a PhD in epidemiology or an MD, and he mentored me through the decision process. And I think everyone is different, right? Where you want to end up, but for me, I think one of the things that I came to an early decision about is I would like variety in my career. So I love the research side of it. That's why I wanted to do a PhD or an MD, because it allows you to pursue being a scientist, but it also gives you flexibility to do other things like what I do now, right? Which is have a little bit of variety in my week.
You just mentioned how a lot of the things that you all do, it can be done virtually, which I think is a very neat idea. Do you think after the pandemic is no longer an issue, do you think some of these things will remain virtual just to, I guess, streamline and make things easier on everyone?
Yeah, I think so. I think a lot of my colleagues have been saying, I'm never going to go back to everyone coming to the office because it's inefficient, right?
Right.
And the really interesting part about all of this is that, a lot of physicians don't do home visits, right? Maybe only a third of physicians, family doctors, right? Specialists do not, by and large, do home visits. But family doctors, a lot of them do not. And virtual care, the unintended consequence is that, it makes it easier for us to talk to people who are more housebound, right? Mm-hmm. Or who are more frail. And a lot of people have told me that they're not going back.
When you were talking about specializations within having like an MD, could you talk more about that? Because I hear a lot of people talking about it, but it's as an outsider, it's really hard to understand. So after completing 4 years of medical school, what options do you have? So you said that you chose public health, right?
Yeah.
Like you're a public health physician. Like what were the other paths, and then like the sub-specializations and all that stuff?
Yeah, that's a great question. So once you finish, or even before you finish your medical school, in third year or fourth year, you have to start thinking about your specialization. And there's something called CARMS, CARMS, but basically it's a residency matching system that every Canadian medical school student goes through. And essentially you have to pick your specialty, and you can actually pick more than one. And a lot of people actually pick more than one. But basically it's a matching system. It's like a dating system for medical schools and students, So you pick, you as a student will pick the specialization and the schools that you want to, and you rank order them. And then, and schools will interview you. Most schools, some schools won't give you an interview, but the schools that are interested in you will interview you. And then they themselves put you on the ranking system. And then, they try to match your top rank with their top rank, and they go down the list. And it's a matching system, just like, I guess, a dating app. Yeah. And you have to choose your specialization. And about 50% of students will choose family practice. That ratio has changed, over the years. About 50% choose primary care to be a family doctor, essentially. And 50% choose what's called a Royal College degree. So a family medicine degree is typically 2 years. A Royal College degree is typically 5 years. And Royal College degrees is for specialists like cardiologists, respirologists, public health physicians like, myself, where the training.
Yeah, so we can just move on to the next question, I think. So you're part of Bruyere's ongoing innovative goal of supporting the healthcare needs of Canada's aging population, like you were talking about earlier, and you use AI and algorithms. So we were doing a little bit of research on you, and we found that some of your current research revolves around using big data to create algorithms at Project Big Life. So we were wondering if you could speak more in depth about the end-of-life calculator, also known as RESPECT.
Yeah, a great question. So you're going to give, like, how much time do we have kind of thing? It's true. Like a lot of my research, it's not my research, it's my team's research. Like we work in a team environment. Like research, we always say research is a team sport, because it's not just one person, it's like the team around you, right? But and it includes trainees, students. I have lots of trainees and students who really advance our research program. But one of the things we do, and it's not the only thing we do, but one of the things we do is use, like what you said, big data. Yeah.
I do have a follow-up. So I know, like you were saying, to your point, in Canada, we have universal healthcare. So if I'm going to the doctor, I can use my OHIP card. But in other countries, like say the US, they don't have a uniform health system and they don't have the universal healthcare coverage. Would a project like this, do you think, be possible over there as well?
It's harder. It's for sure harder because they do have data systems like Medicare and Medicaid, but it's more select, right? There's private insurers, blah, blah, blah. So you get a biased sample.
So much. If I could just go back to the discussion we had about MDs, we just had another question. We were wondering if you could talk a little bit more about what people are doing non-clinically after receiving an MD.
Yeah, so there's a lot of career tracks. So in public health, well, you've seen Teresa Tam and Fira Etches, dealing with COVID. Those are our colleagues, so they don't do any clinical work as far as I know. But they're out there and they're doing policy things at a more population health level. So some clinicians will go and do those leadership roles. Jane Philpott, is a MD. I think our Minister of Health is an MD. So some even go into the political world. Fossey in the CDC, is a MD, right? And then you have people like myself who. Public speaking is not my thing, and I don't like to be in front of camera. So it's a bit ironic I'm in front of you, but like I rather be, analyzing data and looking at data and producing knowledge and evidence, and, I'm a data geek, so I like data, and so I end up in research, right? And so that's what I do. Some people love education and they end up, leading, becoming deans of medicine, or, doing undergraduate teaching. And that's the majority of what they do. Some people, do completely different things. I think we were talking about, some people don't, it's rare, but, some people don't even do any residency training, and they take an MD and they go out and they change the world, David Naylor, I believe, is one of those people. I was telling you, he was a Rhodes Scholar, did his MD. I don't think he did any residency training. Now I think he's a University of Toronto's, president, and he's done a lot of influential things, including during SARS, and I'm sure, after COVID and during COVID. And, there's a lot of different roles that you can do. And I think what you'll find with the MD degree is that some people love practicing clinically, and obviously the vast majority of people do, but if you want a lot of variety in your practice, you can do a lot of other things. And to be honest, it's limitless. Like I have colleagues who stopped, practice and, go into venture capital, and create products that they sell.
I think it's great in theory, but also people need to take those steps to bring into awareness what they are good at, and to be okay with that decision and not try to fit an idea of what they should be good at. So I completely agree. In reflecting back, what would you say are some highlights of your career?
I don't know. That's a great question. I'm still very new, you can ask Doug that, because he's in the later stages of his career. That so far, I find, for sure, I find enjoyment in the clinical care that I give, including palliative care. That's something a highlight. And then a highlight is obviously doing something like research where it doesn't feel like a job to me. And the part of research that I find most rewarding, aside from creating tools, making a difference, and, and just doing research, the research itself, to be honest, it's mentorship and, working with trainees and working with people, to advance and progress through their careers. Because in research, again, it's a team sport, but, ideally you pull your team, everyone pulls themselves, forward together, and I think one of the highlights of my research career so far has been to see, even though I'm early myself, is to see the progression of people, and trainees and new investigators, who are developing just like I am, right, in their research careers and in their careers in general. And now everyone ends up in medicine. A lot of people on our team do end up going into medicine, maybe because it's a bias, because they see me as a medical doctor, but some people choose to do different routes, and I think helping them find their fulfillment in what they like to do, I think that's probably one of the highlights of my career so far as well. When he was starting off his research career, and so I've come full circle, but you can ask him what advice he gave me too at that time. He might give you a different answer. I don't know. It's been a long time. It's been, I think, almost 20 years, but or maybe more than 20 years, but yeah, it's interesting. He's mentored me, and medicine, a lot of it is about mentorship, and if you get good mentorship, I think it goes a long way. Sorry, Harneet, I cut you off.
No, it's all right. I was just going to ask you, I think this concludes the interview. Essentially, we just wanted to ask you if you would like to add anything else.
No, it's interesting, the series that you're doing, and you're going to get a lot of probably different advice from a lot of different people with different backgrounds, with different interests. And I would say medicine, sometimes especially in the health sciences, it gets, overemphasized. I would say that's the route that you should take. And, and, I would say it's definitely not the end all, and be all of all careers. And people in medicine realize that too, because a lot of people do different things other than just clinical care, what we consider, traditional medicine. And I would say it's more, finding your career is more about, finding yourself and finding, again, what you want to do. And medicine, there's so many aspects. The nice thing about medicine, to be honest, is there's so many aspects of medicine that, whatever you like, you kind of can tailor your career to what gives you enjoyment. So maybe that's the nice thing about medicine, that maybe it's not there in some professions, right? But, again, like you have to listen to yourself and what you want. And, obviously there's a bottleneck at, entering medical school, and that's, that's pretty stressful too. But, again, like I would say, don't start with medicine as a default. I would start with, what you want to do and what you like to do as a default, mm-hmm. and what you're good at doing as a default, and then go from there.
Mm-hmm. I think that's really, really good advice. Even for me, I love to hear things like this. I just want to say thank you for taking the time to talk to us today. We really, really appreciate it. It's been extremely insightful, and I think we've learned a lot from you just in the hour that we've had you, which is great. I also want to thank everyone tuning in to another episode of IPHA Talks. We hope you enjoyed this episode as much as we did. And as always, you can find us at UOttawa IPHA on all our social platforms. Have a great week. Thank you so much again.